welcome. This is my February webinar. We are talking about fatigue this month. And fatigue is such a big topic when it comes to MS because it's probably the #1 thing that erodes our quality of life, right? And I've seen estimates of fatigue, affects 40% of people with MS, 60%, 80%. I mean, who knows? It's a lot. And it's the one thing that prevents us from, doing the things that we love, continuing to be gainfully employed. And it's complicated. And unfortunately, in Western medicine, we have yet to figure out how to really treat it in a way that works. So I'm going to try to talk to you about a different perspective today, not because I think that it's going to 100% take away your fatigue, but I do think that there are pearls here that will be useful to you. If you're not already doing them, it would be important to start one by one putting things into perspective, into practice. So I want you to just, as you're listening today, just think about what's the 1 or 2 things I take away from this and that I can start implementing. And nobody does all of this in a day. It takes us months, a few months, half a year to a year. So anyways, here we go. Just so you know, questions go in the chat. You may comment back and forth to each other. I would love to actually see interactions among you all. And if you have a question for me to answer at the end, go ahead and put it in the chat in all capital letters. That helps my eyeballs pick it up real quick because I won't be reading every single comment because I can't read that fast. So I'm going to go ahead and start my screen share here. Hopefully you can see my screen. Yes. Okay, perfect. Okay, so here we go. This, I put this picture up because I just thought, what does fatigue feel like? Like it might just feel like you're walking up a mountain in sand, like that you're just dragging. It's just that feeling of just being weighted down. So we're going to talk about how we can fuel our bodies better and how we can start feeling better. So the topics that I'm going to go over are, what are some of the causes of fatigue? Some of them are easier than others. So we're going to talk about those things. How can we start to boost energy production at the cellular level? So when we think about the body at the biochemical level, where all those reactions are happening, what can we put into place to make those reactions go faster and more efficiently? And then how about nutrition and supplements for fatigue? What works, what doesn't? Because when you're fatigued, you are not in a position to be researching all kinds of diets and trying them out to try to figure out what works and what doesn't. I'm going to try to kind of zero in on what I think is useful. And I'm also going to talk to you about supplements because this is a big area of confusion. All right, so, well, what is fatigue? It's actually hard to define. As I said, it's common in MS, and it can be very vague. It can be difficult to describe, and people will describe their fatigue very differently, from saying like, I'm tired, I'm sleepy, I feel exhausted, don't have energy, it's all very vague. So, and the one thing to appreciate with fatigue is that it's not just physical energy that's impacted. There's so many other things that are impacted as well, which we're going to talk about. Now, how do you know if you're tired or if it's a little bit more than just being a little tired and you're fatigued versus something like chronic fatigue syndrome? Well, people who are just generally tired, like think back to your earlier pre-MS days, maybe you would stay up all night because you were out partying or you were studying, and you would be tired the next day, and then you would sleep, and then you would be back to normal. That's like being tired. That's reversible. You can sleep it off and then you're fine. But fatigue may not improve with sleep. You may sleep. I have patients who sleep 10, 14, 18 hours a day, and their fatigue does not improve. And if this becomes more chronic and there are other associated symptoms, you may actually get a diagnosis of chronic fatigue syndrome, which we actually consider an autoimmune condition. I'm not going to go into that today. So we're just going to kind of stick to fatigue, the tiredness that doesn't really go away with sleeping. So as I said, fatigue can go just beyond your physical body. It can actually give you brain fog. So people often say, I can't think straight. I have trouble concentrating. I can't remember things. I have trouble with my short-term memory. So as I'm going through this list, you're thinking to yourself, is that me? Does that sound like me? Right? And we're just going to try to take inventory of what you might be experiencing. Fatigue also can come with low mood, depression, and anxiety. Okay, I'm not saying that one causes the other. I'm just saying oftentimes we find them coexisting. So think about whether or not you have mood issues or anxiety issues. Muscle pain and joint pain, fibromyalgia, which may or may not be diagnosed. So some of the underlying causes that cause fatigue can also cause muscles to not be able to relax. So they shorten and they become very painful. So we sometimes call that fibromyalgia if you'd meet the criteria, but joint and muscle pain is part of it. Weight changes for sure. People with fatigue that is chronic may gain 10 to 20 pounds over a few years. Headaches, migraines can happen. Also pain. Sometimes it's just widespread pain that may affect the whole body. Sometimes I just call that total body pain in a patient who comes and sees me. And then unrefreshing sleep. You could sleep how many ever hours you think are enough for you, and it just doesn't fix it. You're sluggish in waking up and you're still not well rested in the morning. So let's try to personalize this for yourself. I know we always want to go to an integrative or functional medicine doctor who can personalize the care for ourselves, but I'm going to challenge that. I think if we have discussions like this, and I give you information that makes sense and that it's actionable, and you as a person who's not a trained healthcare professional can understand, I think you can start personalizing this for yourself. So let's think about our own personal experience with fatigue. I want you to think about when we're trying to figure out like what caused this fatigue, what may have allowed this to brew under the surface. And for many of us, it is MS, but let's kind of go a little bit deeper. What was happening in your life prior to the onset of fatigue in the previous month, 6 months, years? Was there a lot of stress? Were you working really hard and doing too many things? Was there an illness? Was there an MS diagnosis? So there's often a cause if you can kind of think back. And sometimes I have my patients make a timeline where they go from like birth to present, they put in all their important life events, and they just try to drop in when different symptoms came in, and it helps you kind of see things more holistically. And then if you ever make one of those, take it to your doctor, and hopefully they'll care to see sort of the progression of your condition and how things have happened. Okay, speed of onset. How fast did your fatigue come on? Was it over a short period of time, like a few days, or it took a few weeks? Or did it just creep up on you so slowly that you really don't know when it happened? Okay. And the reason that's important is that if it onset quicker, where you're like, yeah, I do remember in May of 2020, when people start giving me dates, that's like a big clue to me. They're like, oh yeah, something happened. I don't know what it was. May of 2020, all of a sudden, I just wasn't myself anymore. I couldn't do the things I used to be able to do. This points to something like an infection. It could be a viral infection, could be a bacterial infection. It could be due to an injury. Maybe you got injured working out or doing exercise. Maybe you were in a car accident. Maybe it was during pregnancy or during labor and delivery. So if you're, think about that. Can you sort of pinpoint how fast your fatigue came on? It may be one of these reasons. that could be your underlying reason. So for example, people with chronic fatigue syndrome oftentimes will say, I was traveling, I got really bad diarrhea, I came home, I was never the same. I just had fatigue. Bacterial infections can do that. So how do we treat that person's fatigue? Well, you could give them stimulants and make them feel good for a short period of time, but that's not really the long-term answer. You try to make sure if it was a gastroenteritis, let's support the gut. Let's build up the microbiome. Let's figure out how we can reverse the thing that caused this to happen. And then if your onset of fatigue was slower, it may point to some of these causes. Maybe it was due to changes in hormones. Maybe it was due to menopause, for example, just changes that happened, or maybe stress changed your hormones, and that was the cause. Could be nutritional, like chronically eating convenience food or foods that just don't nourish your body and you don't have the building blocks, or eating foods that are you've developed sensitivities to. Stress can do it. Fungal infections tend to be really sneaky. They take a long time to manifest. And also autoimmunity, MS, the fatigue doesn't like just fall on your head all of a sudden, it just sneaks up on you. You can't quite pinpoint how it happened, but here you are. And now you've got this thing that you've got to figure out. So this is why I ask you to think about the speed of onset. And then it's really important to figure out what makes you feel better and what makes you feel worse. And the obvious thing here is do more of the things that make you feel better and do less of the things that make you feel worse. And I know this sounds really common sense, but like if exercise makes you feel better, you've got to start doing more exercise, right? But this may also be a clue as to what may be behind your reason for fatigue. And also think about your pattern of fatigue over time. Is it like up and down all the time? Has it been getting steadily worse, steadily better, or totally unpredictable? Because I think people who struggle with fatigue, as with all of us, we all have just short-term memory. We forget that we have made progress. And sometimes progress is slow, but it's still progress. I have this lovely patient who desperately wanted to walk long distances. And when we started working together, she would say, I said, how long do you walk? And she'd say 2 houses. And that's all she could do, because then she'd be wiped out. So over time, she would say, I'm walking 10 houses. I'm walking half a mile. And then, then she was telling me she's walking 2 miles. And then I remember she got COVID. She had a big setback and she was back to walking 10 houses again. But she forgot that she had been, worked her way up to 2 miles a day. So it's good to keep a diary, just an easy diary of what you're doing, so you can start kind of seeing your fatigue over time, or you can just rate your fatigue over time. Because I think sometimes we do make progress with fatigue, but we don't see it because it's slow. Okay. If you have fatigue, hopefully your doctor has done these things to you. Hopefully they've ruled out anemia, low red blood cells, or low hemoglobin. Okay. There's many reasons for this, but it should be ruled out. And I find that when I see patients with fatigue, sometimes they are anemic and sometimes they have low iron and nobody's checked. I'm not a smart doctor, but I have lists that I go through because I want to make sure that if there are easy reversible causes, I'd like to start there, right? Low hanging fruit first. Low, and people who are also are vegetarian or vegan are at risk of being low in iron and low in B12. B12 is really important for energy production. So you want to make sure your B12 level is somewhere between 500 to 1,000. Okay. Thyroid problems, right? Let's make sure your thyroid is ticking really nice and well. So it's not really crucial that your doctor checks the entire thyroid panel, but a TSH and a free T4 is a good place to start. I like TSH between 1 to 2, even though the range goes from 0.4 to 4. And a free T4, if it's like close to 1.3, I'm really excited about that. Now, if your numbers are far from that, I would look at patterns. I would like repeat another set of thyroid labs in, 3 to 6 months to see what those numbers are doing. Because one set of numbers in time isn't the entire story. I would also ask your doctors to check for antibodies against the thyroid. There's two different antibodies: anti-thyroglobulin antibody, anti-TPO antibodies. Okay, anti-thyroglobulin and anti-TPO. So one of the most common autoimmune diseases is Hashimoto's disease worldwide. So antibodies against the thyroid. And guess what? Because we have proven we are good at getting an autoimmune disease, it means that we're good at getting other autoimmune diseases, unfortunately. So the more we can do to help quiet down the autoimmunity, get the immune system to behave a little bit better, the less chance that we can start building on antibodies to other things. Make sure your blood sugars are okay. Elevated blood sugars can also lead to fatigue. So, but also really good tight blood sugar is important for MS, because anytime blood sugar gets a little wacky, starts like going up a little bit, you just basically make inflammation. And that's the last thing any of us need. Okay, and then there's sleep apnea, of course, right? Better diagnosed in older men who are overweight, but oftentimes women who are younger and smaller don't get diagnosed. They get, nobody picks it up in them. So if you're not sure if you have sleep apnea, and you don't have to be overweight to have sleep apnea, but weight is a risk factor, ask somebody who observes you sleeping. Do you stop breathing at night, right? Do you take a few short breaths? They get successively shorter and shorter, and then you kind of pause, and then you wake up and take a bigger breath, and then you go into doing that pattern again. Just not snoring is not enough to say you don't have sleep apnea. And if nobody observes you breathing, you can take your voice memos on your phone before you go to bed, hit start. And when you wake up in the morning, hopefully 8 to 9 hours later, you listen to it and see if you sort of stop breathing throughout the night. This is my poor man's test for sleep apnea. This is not a way to diagnose you. You do need to go to your doctor and get a sleep study done. Sometimes they start with a home sleep study, and then they'll do one in the lab. But it's really important, because I think we're all on the same page when I say oxygen is important, right? And we don't want your tissues to starve of oxygen overnight. Okay, so I keep talking about underlying imbalances behind fatigue. Like, what the heck does that mean, right? Let's talk about root causes. What does that mean? Okay, so if you have fatigue, what are different things going on in the body that can produce fatigue? Okay, let's talk about those things. Ooh, this is a big one. Mitochondrial dysfunction. So the mitochondria are the parts of the cell that produce energy for us. And every cell has hundreds, if not thousands, of these little tiny units that pump out ATP molecules. When these mitochondria get damaged and they don't work well, or they shrink in numbers, we can't produce enough energy. And that we call fatigue. Okay, so we want to make sure we have healthy mitochondria. Think Dr. Walls here. Doesn't she always talk about mitochondria? So mitochondria play a really important role in MS. Gastrointestinal imbalance. So leaky gut is something we talk a lot about in holistic medicine, integrative and functional medicine. So if you don't have a good tight lining of your GI tract, that may lead to fatigue. Also, disruption of your gut microbiome. So how do we get this system to work better, right? There are ways of putting things into practice to help boost gut health. And I've actually just recently developed a program for this. So I'll be talking about that towards the end. Hormone imbalances can lead to fatigue. So of course, we always think about low thyroid and fatigue and low energy, but the hormones don't work in isolation. They all work together. They modify each other. They change each other's receptor numbers. So think about, I'll tell you a story. Like, for example, let's say you are chronically stressed. Your body's going to respond by pumping out cortisol from your adrenal glands. There's one adrenal gland on top of each kidney. And so that's how we keep up with that stress demand. Then we have this high amount of cortisol flooding our system, and we're compensating. But here's what also happens downstream. High cortisol inhibits thyroid. So if you have a thyroid problem, which I wouldn't be surprised, there's probably like a third of us in here, or if not more, that have a thyroid issue. If our thyroids aren't working as well, how about we work upstream on the underlying cause by reducing stress to reduce cortisol so that thyroid can function better, right? So that was just one example of a hormone imbalance contributing to fatigue. And then, of course, the immune system getting wacky and causing too much inflammation. This is very much connected to fatigue. And if I can, again, use the model of chronic fatigue syndrome, like people with chronic fatigue syndrome actually have a lot of inflammation up in the brain. And as a result, they are quite fatigued. Okay, so why are these systems breaking down? Why are the mitochondria not working? Why is the gut dysfunctioning? Why are the hormones out of balance? Well, it could be because of infections, COVID or EBV or any other really viral infection, bacterial, fungal infection, toxic exposures in the environment. There's many things we can't influence and not get exposed to because they're just in the environment, but there is so much we can influence. So we're going to focus on that, in future discussions. Trauma, emotional trauma, physical trauma can cause your mitochondria, your gut, your hormones to go out of balance, as can stress. Poor nutrition, lack of sleep, lack of exercise, all of these things can cause these systems to break down. So on this list, there are things you can influence and things you have less influence over. So what do? We talk about the things that we can influence. And I want to also just circle back on the mitochondria because they're so important. Today somebody in one of my groups at Stanford asked, how do I go get a test to see if my mitochondria are working? We do have some tests, but they're not great and they're probably very expensive, and I've never run them for those reasons. So here are some symptoms that can point to mitochondrial dysfunction where we know we got to work on your mitochondria. Fatigue, mood changes and anxiety, headaches, migraines, pain, fibromyalgia, and vague neurologic symptoms, maybe something like tinnitus, or you have some visual thing that your neurologist says to you, there's nothing there. Everything is fine on your exam. Your MRIs are fine. It just is, let's just watch it. If you are hitting on a lot of these bullet points here, we need to talk about mitochondria and how we can optimize that for you, okay? So you don't need to go out and get fancy tests. If anything, I'd rather you spend the money on the things that are going to help you just fix your mitochondria, right? Like really good, high quality plant-based foods. Okay, and so as we go through talking about how to repair these systems, I always think of balancing things. And this is something we say in functional medicine. We always say, remove what's damaging to the body, like infections, like try not to get a COVID infection. A vaccine might help. Minimize your exposures to toxins. So remove what is damaging to the body and then give the body what it needs. Good food, rest, sleep, love, connection, joy, right? Some of those things are, in a different realm, but they're really important as well. And then the way we're going to go about improving fatigue is to use lifestyle. There are no shortcuts. If I knew the shortcuts, I would tell you, and I see a lot of chronic fatigue patients or MS patients with fatigue. I would love to have like a magic wand and fix it, but it's hard. But there's hope because there are things you could do. So eating clean helps. That means, eating organic as much as possible, plant-based foods as much as possible. Managing stress, like we've got to figure out how to reduce the number of stressors coming into our environment, and then building skills to better manage the stress. And we're going to move our bodies. When you move your body and exercise, you build more mitochondria. Is there a drug that can build more mitochondria? No, there isn't. Okay. You're going to minimize your toxic exposures, and you're going to work on sleep. Enhancing sleep helps out your mitochondria. You build a better, healthier microbiome. Your gut starts to repair. So these are your main tools. And this is why in our Truemedicine program, these are the 5 lifestyle pathways that we're always pushing on. Like, this actually is the answer to improving your symptoms of MS, to improving mood, improving fatigue, or whatever else you might be experiencing. That doesn't mean that there isn't a place for medications. There is. And it's not this or that. It's together. We want to integrate and use all of our tools, because what we are all dealing with is complex, and it is really challenging to work through if you're trying to go on the internet and just figure it out yourself. By the way, I just think none of you who don't have formal training in the health sciences or healthcare should have to go and figure out the internet. I didn't even know this as a physician, and I had to go to many conferences over many years and get many board certifications to be able to synthesize what it takes. So I hope this is helpful to you. And if some of this sounds like soft medicine, I might agree with you. It's soft, it's gentle, it's it's going to work with your body on a physiologic level. We're not trying to pound anything into you here, but these are powerful, powerful tools if you start using them. And it doesn't take that long to start feeling the benefits. So lifestyle habits will improve your immune health and get your immune system to be less wacky and more regulated, and less on that autoimmunity side. You're going to be able to restore your gut health. You're going to balance your hormones. And if there are infections, you can start addressing them through this as well. Now, I'm not saying that this is all that you do, but this is actually a big start. Okay, so how do we start putting the pieces back together? Lifestyle is how you start putting your health, your cellular health back together. We don't have drugs for this, right? So this is what we are left with. And unfortunately, it does require work. But when we're in a group together with other people who care to also think this way, it makes it easier. So this is why being in community and healing together is so important. And when I say healing, I don't mean that we're going to cure MS. I wish we could, but I think we can still create a healing environment where we can have greater quality of life and greater function, be able to engage with our loved ones and maintain our independence as much as possible. Okay, so I call that healing. Sometimes I use that word and people get upset with me, but I refuse to believe that there is no such thing as healing when you have a diagnosis like this, because that kills my hope as an MS patient. And, I've worked in hospice and palliative care, and I have seen the power of hope and healing even in the last day, hours of life. So I'm never going to take that away from anybody, and we are going to aim for healing here. Okay, so what is the best diet for fatigue? Okay, so the way we receive information makes it feel like there are all these options and we have to choose one, right? And when we look at the data and literature, it makes it feel like this is better than that. But I can tell you, as an integrative doctor who's worked with a lot of patients, not everybody will stick to a ketogenic diet. And not everybody can stick to a Wall's protocol diet. And not everybody can stick to a vegan or vegetarian diet. So your job is to figure out what is the diet that's going to work for you. So for those of you that know me, you know what I'm about to say, right? Whole foods, plant-based diet. So the whole foods part means you're choosing foods that look like what they grew like in nature, right? So all of those things I can see, like picking that off of a tree or out of the ground, right? It's not chopped up. It's not in a can. It doesn't have a nutrition label on it. And the second thing I'm always going to say is it's plant-based. At least 80% of your food that is coming in is plants. So here's an example. I would say this one is just 2 eggs and the rest of it is just plant-based foods like maybe tofu and a bunch of colorful vegetables. Just visually inspect your plate. what percent of the surface area is plants? That's it. So rather than having a big steak and 2 pieces of asparagus, hopefully it's a bunch of colorful vegetables with just like a little bit of steak. That's the right way to do it. And you get to choose what many of those foods are, because we all have different upbringing, preferences, cultural influences. We have access to different foods, different budgets, different tastes. So I could not sit here and create a diet for each and every one of you. I'm going to challenge you to do that for yourself. And I hope you feel empowered, because these are big principles to think about, right? So go look in your kitchen. How many things in your fridge are processed and how many things are whole foods? Look in your pantry and ask yourself the same thing. Hopefully, when you open up your fridge, you see color, you see plants, and if that's not what your fridge looks like right now, you can get there. All right. So let me just start by talking about food sensitivities, because we talk a lot about diets for this and that, but food sensitivities are quite problematic for people with MS and autoimmunity, and even in fatigue. So if our gut health is not great, it's a setup for food sensitivities. It predisposes us. So maybe we took a bunch of antibiotics, or we're just eating a bunch of processed foods. All of these things can damage the gut and cause what we call leaky gut or hyperpermeable gut. Basically, long story short, this revs up the immune system, because the gut and the immune system sit right there together, and they're looking to see about what's coming in. So if your gut is not working, it can lead to you developing food sensitivities. And if you continue to eat the foods that you are sensitive to, you're going to keep creating inflammation, both in your gut and in other parts of your body. Top 2 offenders, gluten and dairy. There's no question about this. Some of this has to do with the fact that these foods are so prevalent in our diets. We eat them all the time, and you'll realize, and so your immune system has a lot of access to these foods. And then, gluten is a molecule it's a protein found in wheat, barley, and rye, and some other grains, but it's very immunogenic. So the immune system, for some reason, can recognize it really well and get confused and think that it's something to be attacked, so may produce antibodies against gluten. So anyways, all you just need to know is you may very likely to be sensitive to gluten and dairy. How do you deal with that? Well, you could go get blood testing. They're not terribly accurate. The gold standard is actually doing an elimination diet followed by a reintroduction. So ideally, if you just choose to do one food, cut out gluten, 3 to 6 weeks, you cut that food out, or maybe you choose to do multiple foods, up to you, depends on whatever you're up for. You remove those foods for 3 to 6 weeks, ideally 6 weeks. And then, and actually what you're looking for is, do you feel better? And sometimes people feel worse in the first 3 weeks before they feel better in weeks 4, 5, and 6 of the elimination. And then after that, you pick one food at a time that you've eliminated, and you reintroduce it by itself heavily over 72 hours to see if a symptom comes up. This is the best way to decide if you do or do not have a food sensitivity. And if you come up with vague answers, you can always recheck it down the line to see if the same vague or the same vague symptom came up a second time. Okay, these are hard to do on your own. And I try to simplify it. I would love for people to do 10 foods at a time, because if you have one food sensitivity, you likely have others. So, and removing just one food out may not make you feel that much better, but I also want it to be simple. So if you're working on your own, pick just 1 or 2 foods to cut out for 3 to 6 weeks and then reintroduce it. But again, I've put a gut program together. So if you want to do this with support, I'd love for us to do it together, because it does require, some support. Now, if you're going to start cutting out a bunch of foods, like for example, you're going to cut out gluten, which means a lot of the carbs are going to come out of your diet. And let's say you are a person who doesn't have tightly controlled blood sugars. So you have low blood sugars or high blood sugars, or you're on medications for diabetes. Please work with your doctor, because if you are prone to unstable blood sugars and then you pull out all your carbs, your blood sugar can tank and you can actually die very quickly, actually. So we want you to be safe above all else. But, you know, working with a provider who can support you through this is really important. Okay, so let's go through a couple of diets. I put down Paleolithic diets. You know, a lot of people go paleo. Now, there's a lot of different kinds of paleo. There's like the Atkins, you know, type where you get to eat sausage and bacon and steak, and it's all just so great. Some people, and you will probably lose some weight, but you know, your cholesterol will probably go through the roof. Okay, and you'll probably get quite inflamed because you're consuming a lot of animal fat and a lot of toxins that come along with animal fat. A lot of toxins like are fat soluble, so they sit in the fat of the animal. This is one of the reasons we want you to cut down the animal products. It's not just because of the nutrients, but also the toxic load. So this is actually Dr. Wall's paper where she compared a ketogenic diet and her modified paleo diet and looked at outcomes. So and let me just explain to you what a Paleolithic diet is. It's basically the food of our ancestors, our hunters gatherers, because you know, the foods that our ancestors ate actually has a lot to do with what our DNA is sort of set up to deal well with, right? And it's kind of a fascinating thing. We don't have to go into detail about it now, but anyways, the diet she's put together is eating lots and lots of sulfur-rich and leafy greens. It's many, many cups a day. You're flooding yourself with these really good healing molecules. You're eating meat and fish. These are allowed. Organ meats, if you can do them, and fermented foods to build up your microbiome. This is how we get the good bugs into the microbiome. Okay, and then you're cutting out grains and dairy. So her study, I think it was 36 weeks, and the people who did the modified paleo diet actually showed statistically significant improvement in fatigue. The ketogenic side, they did not show improvements in fatigue, but they did have lower insulin and blood sugar levels, which is actually really important too. This was not a huge study, but I think, I can't remember, I think maybe it was like 36 people, I could be wrong, but anyways, or maybe it was actually less than that. So, but it was not a giant study. And so this is one option. I think this is a wonderful diet because it is a whole foods, plant-based diet. She incorporates a lot of color, fermented foods, and avoids foods that aren't terribly nutritious and can be really problematic for those of us with MS, like grains and dairy, gluten and dairy. Okay. So, and I've linked the article down here for anybody who's interested, but this is a very useful tool and very, useful. Okay, so I want to talk to you about ketogenic diets. Even though in the last slide, I said that in her study, she wasn't able to demonstrate that ketogenic diets improved fatigue. There is actually data that it's an important tool for fatigue. Okay, so and let me just talk about what a ketogenic diet is. The point of doing it is that it actually can support and boost your mitochondria based on just what you're eating. And if you can fuel the mitochondria, you can produce more energy. And it's a low carb diet. It's a moderate protein diet. It's not high protein, it's moderate. And then it's high in plant-based fats. And that's sort of where the magic happens because you're getting your body to shift from breaking down carbs for energy to breaking down fat for energy. And this results in weight loss, but it also results in ketone bodies. Okay, so, and ketone bodies are a super fuel for the brain. Your brain starts getting really well fueled, brain fog improves, fatigue, mood, anxiety, depression, pain, all of these things can improve. And so this is something I use a lot for my fatigue patients or chronic fatigue syndrome patients. And it's actually kind of a delicious diet because you get to eat a lot of plant-based fats like olive oil, olives, coconuts, avocados, and nuts and seeds, you know, if they're not super carby. So there was a study that put people with MS on a ketogenic diet for 6 months. Nobody had a bad outcome, so it was well tolerated. And when they did self-reported questionnaires, there was a 50% decrease in fatigue and depression. And there were lots of other things that improved as well. So like perceived disability and cognitive function. So I think this is another very reasonable diet. Again, it's a whole, as long as you're following it in a way that it's a whole foods and plant-based diet that's full of color and lots of fermented foods. And by lots, I mean like a tablespoon or two a day of a fermented food. You know, you kind of start pairing these with your meals and you kind of get used to it and you might actually really crave it after a while. My kids love fermented foods. It's a taste you can acquire. Again, this is another diet. If you have any blood sugar issues, whether it's high or low or unstable blood sugars, or you're on diabetes medications, please work with your practitioners to make sure you don't bottom out your blood sugars when you pull those carbs out, right? Let's make sure we like live through this and see the benefits, okay? And then now I'm going to kind of segue into supplements. I don't have great news for you actually when it comes to supplements. There isn't now. We just don't have a lot of data. And I really tried to pull MS specific data. There isn't a lot. That doesn't mean that these supplements aren't useful. They are, but they're also not the main part of treating fatigue. And I have never, ever seen people go on the supplements that I'm about to show you and all of a sudden say, hey, my fatigue is so much better. Okay, never, not once. Okay, so I think the only time that it makes sense to use supplements is when you are putting good lifestyle habits in place. You can add on the supplements to kind of bridge you until you get to a better place and you can start peeling off the supplements. Okay, so this is my non-negotiable one for so many reasons. We call vitamin D a pleiotropic vitamin. Basically, it means it does everything. It's almost easier to talk about what it doesn't do. So it's a very potent modulator of the immune system. It just straightens out your immune system. It just works better. It's good for surveilling the body for abnormal growths that may become a tumor or a cancer. So this is why you want to have a nice, robust vitamin D level. It has antiviral properties. So there are protocols where somebody thinks they're coming down with a cold or a flu or a COVID. You give, 3 days of high dose vitamin D and hopefully you can avert a really bad infection. So I just pulled one study. They basically took people with MS and checked their baseline vitamin D levels and then gave them vitamin D until they got them over a vitamin D level of 30, a total vitamin D level of 30. And what they came back and reported was that their quality of life and their fatigue improved. That's supposed to say significantly. Okay, so vitamin D is powerful and it's cheap. Like it could be $5 a month if you have to pay a copay, right? For some people, or, you don't need to get it as a prescription if you could just pick it up over the counter, but your dose will vary because of how your body might metabolize it. So I always tell people, pick a dose, maybe between 2 to 5,000 IUs daily, international units daily, do that for 8 weeks, and then go get tested to see what your body did with it. And then your doctor can help you adjust your dose as needed. For most of us with MS, I think getting to a vitamin D level of 50 to 60 is a good place to start. In some cases, it might actually help you to get even higher, but that's something you'll need to talk to your neurologist about because really, really high vitamin D levels, and by really high, I mean, getting closer to 80 may actually even be really helpful with MS, but it may have some onward effects on bone health. So we just want to make sure somebody who knows your medical history decides what's the right range for you. Okay, CoQ10. And I've basically taken the most commonly used supplements for fatigue that are oftentimes found in combination products. And I'm just giving you the different components so that some of you might be taking something for fatigue as a supplement. So I want you to understand what each component is. CoQ10 is something we use a lot for our healthy heart patients because it helps fuel the heart muscle, right? It works in the mitochondria and helps with producing energy. So organs that use a lot of energy can really benefit from CoQ10. So that's the brain, it's the heart, and it's the muscles. So if we can fuel our mitochondria, these three organs will work really well. Okay, so there was a randomized double-blind placebo-controlled study that showed that using 500 milligrams of CoQ10 every day significantly improved fatigue and depression in people with MS. Okay, so this is a high-quality study. It was randomized, double-blind, all of that. They used actually a higher dose of CoQ10 than I normally use. With most of my patients, I do like maybe 100 to 300 because it's an expensive supplement. It's just not, useful long-term. And we know that at about 1 to 300 milligrams, there's benefit for fatigue. So anyways, again, I'm not giving out all of this information for you to run out and buy all these products and take them, but I want you to know how to use them. So if you are already using them, look and see how you do, how your dosing compares with what I'm saying in the research. And then if you end up working with an integrative provider or a naturopathic doctor, you can have a discussion whether or not this is appropriate for you. And then alpha lipoic acid is, it's a potent antioxidant. And it's anti-inflammatory and it's immunomodulatory. It basically works on the immune system as well. So, we talk about antioxidants a lot. We throw that word a lot, but every time you hear that word, you're thinking about antioxidants putting up a shield around proteins and cells so that they're not damaged. Because as a normal part of how our body functions, we produce molecules that are dangerous. Even when we eat and digest food, we produce these dangerous reactive oxygen species, and they create this oxidative stress. So then we have to use our antioxidants to neutralize it. So this is why it's important to get a lot of antioxidants. We build antioxidants, but guess what? We get a lot of antioxidants from plant-based foods. Plants actually produce antioxidants to protect themselves, but when we eat those plants, we get that cellular protection. Okay, so I couldn't find a great study on alpha lipoic acid and MS fatigue, but I thought this one was interesting. This was a 2-year-long randomized double-blind study of secondary progressive MS. And these people over 2 years showed a 68% reduction in brain volume loss. That sounds pretty interesting, right? And alpha lipoic acid is generally pretty safe to take. Again, I want you to be supervised by somebody who understands these things to make sure there's no interactions, but you may find this in a fatigue supplement that you may be using, or if you're looking to use it. So I just want you to understand it. And I forget now what the dose they used is. I can't remember if it was 500 milligrams or 3,000 milligrams, but in studies, all kinds of doses are used. So this is why it's important to work with somebody who understands these supplements so they can dial in the right dose for you. And then carnitine is something that can also help with energy production, also found in mitochondria to produce energy. And the data is kind of inconclusive on this. I couldn't really, come and tell you that you must be on this supplement. I just don't see enough data. But food sources of this are animal products, especially like meats that are that redder color will have more carnitine in them. And the reason I put the food sources here is that there are many of us here who may be on plant-based diets, or we may be vegetarian or vegan and getting very little animal products. I just want to suggest, if you are open to the idea that you may, if you are experiencing fatigue, if it is something that's acceptable to you, to include some animal products and see how you do. Now, I understand there's religious reasons and other personal preferences, animal rights issues, like I get it. And if this is repulsive to you, I'm completely on board with you. Like I would never force anybody to eat anything they're not on board with. But it's an idea, because if you can supply carnitine in food form, it might help your fatigue. And one thing I also want to say is, I think it's safe to say that nutrients from food are better absorbed than nutrients from supplements. So anyways, let's move on. And then medicinal mushrooms can be also useful for fatigue. I would really like you to work with a practitioner on this one. They can be anti-cancer, antiviral, and they do work on the immune system. They work through many mechanisms and many different systems of the body. They work through the neuro system, muscles, immune system, and they can be very powerful. This was an 8-week study looking at reishi mushrooms in chronic fatigue syndrome patients, and they showed an improvement in fatigue. So I think, if you're not sure where to start with mushrooms, start with eating them. Go to your farmer's market and skip the white button mushrooms, like go to the fancier ones and try to bring some of those into your diet. And I think it's important to be safe, because when I say immunomodulatory, I mean that like they can suppress the immune system and they can stimulate the immune system. And we just want to make sure we're being careful. So some mushrooms are more potent than others, and I want to make sure that you're being safe. Oh, and if you love mushrooms, please watch these 2 movies. The one on the Fantastic Fungi has my most beloved person that does time-lapse photography, Louis Schwartzberg. It's exquisite. And then Paul Stamets, who's sort of a self-taught mycologist, is the person that is being featured. It's a movie about his work. So anyways, please watch it with your family. You will never walk on the earth again without thinking about fungi and mycelium and what's going on under the surface. And then Michael Pollan's book on how to change your mind explores the world of psychedelics for mood. So it's fascinating. I'm not condoning that you need to go out and do psychedelics. I am not trained. I don't know. I'm not going to go there, but I think, and this comes in the Michael Pollan book comes in a Netflix 4-part series. It's fascinating. So let's all learn more about mushrooms. Okay, so if you have fatigue, you're going to rule out your reversible causes. You're going to look for your underlying causes. You're going to work on nutrition and other lifestyle habits. I didn't have time to talk about all of the other things. I focused on nutrition today. I want you to be careful about using supplements. I don't think they work well on their own. They really have to be instituted with you trying to sleep better, get deeper sleep, more exercise. And by the way, with fatigue, I know it sounds ridiculous to ask you to go exercise, but exercise that doesn't help make you crash, just enough where you're moving and staying conditioned is what I'd like you to do. Other things to think about. I'm going to put these on the list just so that they're on your mind. You can talk to your doctors about this. Antiviral medications can actually help some people with fatigue because they have lots of viruses floating around in them. Low-dose naltrexone is a prescription medication that is very safe and well tolerated with DMTs and can help with inflammation and fatigue. I love traditional Chinese medicine because there's a lot of wisdom there and it works with your body. So you might be doing herbs or acupuncture. So I know it may feel hopeless at times with fatigue because it's such a hard symptom, but lifestyle medicine works. I've never had people try it and say, that was a bad idea. I'm worse, right? But the problem with lifestyle is that it's hard to do on your own. And if you're doing it in isolation. So this is why I've created programs to get people to a place where they're supported and there's people around helping. It literally takes a village, right? So, we've had so many people that have told us that, it was nice to have structure and to start seeing the full picture, but also start seeing all the small elements. And finally, actually having the support and the structure to reach their goals. So, and we root each other on because that's what it takes. Not all of us have great support at home. A lot of our family members may not know how to support us, but I want to make sure that there's a place that we can all come and get the support.